Hello friends, as you know that psoriasis is a chronic lifelong disorder and we at Psoriatreat treat psoriasis for last 37 years with homeopathy. And what is our experience and what homeopathy offers for the treatment of psoriasis? If you say that homeopathy is the best system treatment of psoriasis, but does all the patient get equal or similar results? How can we promise them? My answer to this question is big no. And one has to be very sincere and listen to this. Because it depends on the severity of the patient, the chronicity of the patient, and the treatments that has been taken by the patient before they come to homeopathy. So I can say there are 4 categories of psoriasis patients that I treat. So whenever a patient comes to me, it is not that all these 4 categories are fixed. They are not watertight compartment. But if you try it, you can go from one stage to another to 3 stages. So first of all, I will say the first category of the patient, that is who get complete recovery, that I call simple, uncomplicated psoriasis patients. These are the patients who come to homeopathic treatment. They may have the large amount of psoriasis, but in case of their stage, they have not taken any other treatment. They have come to me, and they do not have any other complications. Their lifestyle is good, their diet habit is good, and their state of mind is also good. All these patients, I call that they are curable patient, almost 90%. Because their psoriasis and their power to react to medicine is good. But I must caution here, all these patients are, when we give the treatment, since their immunity is very strong, after giving the treatment, in this patient we experience severe aggravation. So after giving the medicines, instead of disease coming less, we notice that it increases almost 30 to 40% more initially. And here the patient gets frightened, impatient, anxious, and he says that my disease has increased, doctor, instead of it should be less. But no, it is his body has reacted very good to the medicine. And over the period of time, this period of aggravation may last for 2-3 months, but gradually it goes down and the patient may remain free of psoriasis almost 10 to 15 years. This is the first stage of patients. Then there are second stage of patients who are little more difficult. So here what I find in the second level of the patient is that they are having psoriasis for a long time. They have taken different types of treatment, including the modern science. But since their immunity and lifestyle is good, so they always, when they come to me, they sick. So they are a middle way. That is, if they follow the treatment, they definitely can get to result because their immunity is still good enough to respond to the medicine. So all this second type of patients that I notice is that whenever I start the treatment, initially they feel better. But after some time, they are very happy. Sometimes they drop out of the treatment, but after some time, the psoriasis comes back. And this second time, it is little difficult to treat them. All those patients who continue treatment as I advise, irrespective of their psoriasis better, after some time, gradually their psoriasis comes back. But when it comes back in less intensity. So gradually we notice that when the patient comes, his psoriasis is less, it comes back again in less intensity. Next time it comes again in less intensity, and over the period of time we notice that psoriasis does not come back, or it is just very less, 5 to 10%. And then we say that you can get only this much relief. It's difficult for you to get more because their body has got the highest possible relief. For example, in an examination, nobody will get 100% marks. Somebody will get 60, somebody will get 70. But the passing is somewhere 40 or 35. That is your pass. When you get 30 to 40% of your psoriasis, that is, it's a good result I have given you. For next improvement, you need to continue the treatment. And this patient may get 80 to 90% of the relief and may not return psoriasis 4 to 5 years even after discontinuing the treatment. Then the third one that I say, these patients, I say that these are the patients who have been taking the treatment of psoriasis for a long time. They do not have good lifestyle. They do not have good mental makeup or mental state of mind. Their lifestyle is little difficult, but they are really good patients. They respond to the medicine. They are ready to change their life. So I find in these patients that so long they are taking treatment, they are better. As soon as they drop out the treatment, psoriasis starts coming back. And I have patients who have been taking my treatment for almost 10 years, 12 years. So during my homeopathic treatment, their psoriasis is controlled almost 60 to 70%, and they feel better by treatment. They should not stop the treatment, they have to continue the treatment. This I call as a maintenance. As compared to other systems of medicine, since homeopathic medicine, even if you are taking the medicine for a pretty long time, there are no side effects and they have to continue the medicines. I say that don't ask when you will get better. You improve your lifestyle, you improve your mind status, you improve your other obstacles to your recovery, and that will help you go to the second level. So these are the patients, the of third level. Then the fourth level I say, which are the incurable ones. These are the patients very complicated and they do not respond to the medicine very well. They come to me, they get some 10, 20, 30% relief, but they do not improve anymore. And they always complain that why they are not getting full complete relief. For all these patients, the fourth stage, after studying them for last 37 years, I have devised a new type of treatment which called is an advanced treatment. So all these patients, we have a separate study. We call it a 360-degree study. We have to do a lot of research on them, and we have got a good success in certain cases. So that is another treatment. We call it study of a patient 360 degree. So we do not study the patients only, we study his environment, his relatives, his all upbringing from childhood. And there sometimes we find a good clue. And then the patient goes to the third level, then second level, and some patients also get a good cure. So these are the most difficult advanced cases, and definitely the amount of time and energy we spend with research, definitely it is a bit costly treatment. But as compared to their life and their disease, I feel it's a good and it may not be costly as compared to their treatment. So these are the fourth group, and over the period of time I say, what is the fourth group? Because nowadays the treatment, the psoriasis starts at lower ages. So earlier the disease, more the complications. So when I get a patient that who had psoriasis, started at the 10 and 15 years of age, and he comes to me at the 30 years of age, definitely it is an advanced case, and I always request them to go for the advanced treatment.